The veterinary school at Texas A&M is doing groundbreaking research on pets contracting COVID. Good morning to all of you in the Brazos Valley. I'm Lindsay Lipman.
And I'm Joey Horta. This morning, 25 News reporter Rachel Espaillat shows us how research is being done with our furry little friends.
When we go for a visit, each animal gets their own bag.
Edward Davila, a student at Texas A&M, is preparing sampling kits to test people's pets for COVID.
The fact that they allow us to come into their homes and draw blood and maybe make their pets like a little bit uncomfortable is really encouraging because they understand that the science is important.
The team of researchers, led by Associate Professor Dr. Sarah Hamer, have sampled more than 400 animals living in a house with at least one person who's had the virus across the Brazos Valley. So far, more than 40 have come back with positive results. They expect that number to increase.
For an animal to be confirmed, not only is it testing positive in our labs and other reference labs, but then we send samples to a national veterinary lab where the final testing takes place.
We also take a nasal swab and an oral swab.
Although we are finding animal infections, it's very rare for the animals to be sick.
The team has tested mostly dogs, several cats, and a small number of other household pets. So far, data indicates more cats end up testing positive. If an animal tests positive, they recommend putting the animal in quarantine, followed by more testing.
We're interested in sampling again and again to find out the duration of infection and how long the antibody titer will last.
A pet's positive results doesn't mean it's time to give it away.
You know, you can't say that animals are infecting humans because we haven't seen any evidence that they can, but it's still important, and that's still being communicated with our peers and with the general public.
In College Station, Rachel Espaillat, 25 News.
Although it may be hard, the team recommends staying away from your pets and wearing a mask around them if you do have COVID.